Hello, welcome back to my channel. Today we are going to talk about knee osteoarthritis. Please, if you are new to this channel, kindly subscribe to my channel and hit the notification button. By doing so, you'll be notified whenever we release any of our amazing videos. Don't forget to give this video a thumb up. So today we are going to talk about knee osteoarthritis. Arthritis is so common in our society that you can hardly see an adult above 70 years that have not complained of knee pain or hip pain or shoulder pain. Arthritis presents in various forms. There are many types of arthritis. There is osteoarthritis, there is rheumatoid arthritis, there is a gouty arthritis, there is gonococcal arthritis. But among all of them, osteoarthritis is the commonest. And it is one of the most leading causes of knee pain, hip pain, and also disability among the elderly population. So in this video, we are going to talk about what happens in a knee joint during osteoarthritis and what you can do to relieve the symptoms of osteoarthritis. In my hand here is an anatomy knee model. So we are going to use this thing to demonstrate what happens in the knee joint during osteoarthritis. Osteoarthritis is a degenerative joint disease. It occurs when there is tear and wear of the cartilage that lines the end of the bone that make up the knee joint. When there is a degeneration of this cartilage here, or this cartilage here, the smooth ending of this bone becomes rough and they begin to rub on each other. In a healthy knee joint, there is a thin layer of hyaline cartilage that covers the end of the articular bone that make up the knee joint. The knee joint is a complex joint. It is made up of three bones: the femur or the thigh bone, the tibia or the shin bone, and the patella or the kneecap. There are two articulations in this knee joint. There is a tibiofemoral articulation and there is also patellofemoral articulation. In a normal knee joint, the end of femur here is covered with thin layer of articular cartilage. Also, the end of tibia is also covered with thin layer of articular cartilage. This articular cartilage provides smooth and lubricated ends of the articular bones. They ensure that these bones move in relative to each other without much friction. Also, there is the presence of joint cavity, and in this joint cavity, there is also a presence of synovial membrane that produces or secretes a fluid called synovial fluid. Synovial fluid helps to lubricate the knee joint, thereby ensuring that femur moves freely relative to tibia without much friction. In arthritis, the smooth ending or the articular cartilage that lines the end of this bone degenerates. Once they degenerate, the end of this bone becomes rough. The joint space or the space between femur and tibia reduces. This leads to rubbing together of these two bones, and that is why you hear cracking or grating sounds when you move the knee joint in osteoarthritis. In severe form of osteoarthritis, beyond the degeneration of the articular cartilage, there could be also degeneration of fibrocartilage, menisci. There are two meniscus here, two menisci, medial meniscus and lateral meniscus. There could also be degeneration of the subchondral bone, the end of the articular bones that make up the joint. There are many symptoms of osteoarthritis. Number one symptom of osteoarthritis is pain. In most of the cases, patients complain of pain. Number two symptom is stiffness. Patients find it difficult to move the joint. When you ask them to move the joint, they complain that they cannot move it because it is stiff. Number three symptom is there could be swelling. In some patients, you may see that the knee is swelled up. Number four is a loss of range of motion. Range of motion is a movement obtainable in a joint. So when there is arthritis, when there is osteoarthritis, you find out that range of motion in knee is reduced. Number five is a joint enlargement. Because in some people or in some cases of osteoarthritis, there is a thickening of the subchondral bone. Okay, this can lead to joint enlargement. Another symptom of osteoarthritis is muscle weakness. The muscles that work on the knee, which are the quadriceps muscle and the hamstring muscle, may be weak. Another symptom you can see in osteoarthritis is a disability. Patient might find it difficult to perform his or her daily activities. They might find it difficult to stand up from the seat or to climb or come down from a staircase. You can also hear cracking or grating sound because the articular cartilage that line the end of this bone have degenerated. In extreme cases, there could be joint deformity. You might get what we call genu valgum, K-leg, because the ligaments that stabilize the knee are weak. Also, there could be impaired proprioception. Proprioception is a joint position sense. In this case, the patient may not be able to know the position of his joints. Apart from symptoms of osteoarthritis, there are what we call signs of osteoarthritis. Signs of osteoarthritis are those features the clinicians observe, while symptom is what the patient feels. Signs of osteoarthritis include there could be reduced joint space. In this case, when a clinician takes the X-ray of the knee joint, the space between the femur and tibia may be reduced. There could also be subchondral sclerosis. This means thickening of the bone, especially the femur, at knee joints. Subchondral sclerosis occurs when there is a thickening of femur at knee joints. There can also be bone spur. Bone spur is called osteophytes. Bone growth that spike out from the end of the bones that make up the knee joint. These are signs of osteoarthritis of the knee. Remember, signs of osteoarthritis are those features that only the clinicians see, while symptoms are those features that you as a patient feel, like pain, stiffness, reduced range of motion, loss of muscle mass or muscle weakness, or cracking or grating sensation or disability. These are symptoms of osteoarthritis. Then, for causes of osteoarthritis, there is actually no known cause. There a lot of literature attribute osteoarthritis as being idiopathic, no known cause. However, in some cases, there could be secondary knee osteoarthritis. These occur when the knee has been previously damaged. Also, in some literature, osteoarthritis can be classified as primary or secondary. In primary osteoarthritis, there is no known cause. The osteoarthritis cannot be linked with any pathology. But in secondary osteoarthritis, it could be linked with secondary pathology. Maybe the patient had previous knee joint injury. There are other risk factors that can give rise to osteoarthritis. They include, number one, obesity. Remember, the knee joint is a weight-bearing joint. The more you add weight, the more you put more stress on this knee joint. So, obesity or weight gain has been linked to higher incidence of osteoarthritis. Number two risk factor is advanced age or old age. Osteoarthritis is a degenerative joint disease. The more you advance in age, the more the cartilage that lines the end of the bone that make up the knee joint degenerates, and the higher the risk of osteoarthritis. Number three, female sex. Osteoarthritis has been established to be more common in female sex than in male sex. There are a lot of research that have linked this to hormonal changes after menopause. Also, other risk factors include previous history of injury. As I said, in secondary osteoarthritis, if you have had injury in your knee joint, maybe road traffic accident or sports-related injury or other forms of arthritis in the knee, you have a higher chance of developing osteoarthritis. Some other researches have linked osteoarthritis to lifestyle, maybe smoking or abuse of substance. These are just risk factors. Diagnosis of osteoarthritis. There are 4 diagnostic markers for osteoarthritis. Number one, age. When somebody's age is above 50, he stands a higher risk of getting osteoarthritis. So for osteoarthritis to be diagnosed, except in rare cases, the age must be established to be 50 years or above. Number two, problem with carrying on with activities that puts pressure or weight on the knee. If the patient complains that the knee pain is more or is aggravated by walking or jogging or climbing staircase, in which case these activities put pressure on the knee joint, you then question osteoarthritis. Number 3 is a grating or cracking sound when the joint moves. This sound could be heard when the person tries to bend or extend the leg, or when the person ascend or descend the staircase. If you hear this cracking sound or grating sound, also called crepitus, you suspect osteoarthritis. Number 4 is a large bone. Number 4 is a hard bony enlargement of the knee. If the knee joint begins to enlarge due to subchondral sclerosis, you then suspect osteoarthritis. It must be noted that X-ray cannot be used alone to diagnose osteoarthritis. The reason is that in almost people age above 60, if you take their X-ray, you find out that they have signs of osteoarthritis. Signs in this case means presence or degeneration of this subchondral cartilage or subchondral bone. You could also see reduced joint space in elderly people, but these people may not present with symptoms of osteoarthritis. This shows that having signs of osteoarthritis in X-ray does not necessarily mean that the patient is having arthritis. You will mostly use symptoms to diagnose osteoarthritis, but signs can be used to support the symptoms that the patient already had. In summary, X-ray alone cannot be used to diagnose osteoarthritis. The patient must present with these 4 symptoms I listed. Then, other diagnostic tests like ultrasound for viewing the joint, MRI, CT scan, or laboratory examination can be used to rule off other forms of arthritis. Remember, there are many types of arthritis. There is rheumatoid arthritis, there is infective arthritis, there is even gut, there is reactive arthritis. So we use other forms of examination or laboratory examination to rule off other conditions that can lead to knee joint pain. Apart from arthritis, there are also other conditions like polymyalgia that may give rise to knee pain. Treatment of osteoarthritis. Osteoarthritis treatment is aimed at relieving the pain and the symptoms. One of the main goals of treating osteoarthritis is to relieve the pain, relieve joint stiffness, improve activities of daily living. If the patient presents with pain, some could benefit with over-the-counter drugs, analgesic to relieve the pain. Then, there are a lot of exercises that could help to manage symptoms of osteoarthritis. If you check my channel, you see many exercises that have been proven to benefit patients with knee osteoarthritis. These exercises will help, first, to relieve pain, 2, to relieve joint stiffness, 3, to improve joint range of motion, 4, to relieve swelling if there is swelling, 5, to improve muscle strength, 6, to improve activities of daily living. The goal of physical therapy treatment is to make sure that while we relieve pain, we also ensure that you return back to your normal daily activities. Also, in advanced form, when there is a total degeneration of the cartilage and subchondral bone and even the fibrocartilage in the joint, surgery could be recommended. Some other literature recommend steroid injection at the joint to relieve pain. It must be noted that osteoarthritis has no permanent cure. What the healthcare professionals do is to relieve the symptom and make sure that you live your life without much pain and disability. They will ensure that you return to your daily activities. So follow me up. I'm going to show you a couple of exercises you can do to relieve symptoms of osteoarthritis. There are about 5 main exercises that have been proven. Number 1 exercise is isometric quadriceps contraction. In this exercise, you put a towel under the affected knee. You lie spine facing up. You then squeeze the leg. Use the knee to press down on the folded towel. This activates the quadriceps muscle and trains it. This exercise has been proven to improve symptoms of osteoarthritis, especially osteoarthritis of the knee. Number 2, straight leg raise exercise. In this exercise, you lie on a mat or on a bed or in a couch. You squeeze the affected leg. You raise it gradually. Hold it in the air for 3 seconds. Drop it. This exercise also helps to activate and train all the muscles of the lower limb affected in osteoarthritis. Number 3 exercise is a heel slide. In this exercise, you lie face up on the bed. You then slightly move your heel towards your buttocks and push it back. This exercise also helps to improve the muscles that work on the knee and also improve knee range of motion. Another exercise that could be helpful is leg kick or leg extension in sitting. In this exercise, you sit on a high chair or on a bed that is high enough from the floor. You then move your leg up. Try to kick your leg up slightly and down. In some cases, you could add 1 or 2 kg of ankle cuff to make the muscle stronger. Another exercise, especially for elderly that find it difficult to get up from sitting to stand. Another exercise that is very good, especially for elderly that may find it difficult to stand up after sitting, is this exercise called sit to stand. Sit to stand. In this exercise, the patient will sit down on a chair with armrests. You gently stand up, pushing your hand up. By doing so, you are training your body how to stand again with ease. Another exercise could be helpful is control stepping. In this exercise, you gently step in first staircase or in aerobic stepper with affected leg and come back. By doing so, you are training the muscles that work on the affected knee. By doing this exercise, you are going to get a relief from the symptoms of osteoarthritis. Don't forget that this is just for a medical advice. Make sure you consult your physical therapist or your doctor before you do any of this exercise. Don't forget to follow me. I have other exercises that could help to improve your knee. I also have videos on how to manage other forms of arthritis like hip arthritis, shoulder pain or shoulder arthritis, and other musculoskeletal conditions that could interfere or affect your daily activities. Don't forget to subscribe to my channel and hit the notification button. By doing so, you'll be notified whenever we release any of our amazing videos. Thank you for coming to my channel. I'm looking forward to seeing you again. Bye.